Namaste. Welcome to your prenatal asana series. We are practicing Namaskarasana or salutation pose today. This asana is usually recommended and safe to practice in second and third trimester. In first trimester, we usually should avoid too much of pelvic opening asana because in the first trimester or the first 12 weeks of pregnancy, we are trying to stabilize the fetus in the womb. So that in that process, it's not suggestive to do much of the pelvic opening asanas or any other pelvic opening practices. If the woman has a condition of previous miscarriage or it's an IVF pregnancy, then extra care should be taken that any pelvic area opening asanas should be avoided at that point in time. Other conditions in which this asana should be avoided is if a woman has a condition of placenta previa, which is the placement of the placenta is downwards towards the cervix or vaginal opening. This is usually told to the women in about 4th month. That where is the placement of the placenta. So most women are actually aware of the placements. So you should be aware of the medical conditions, and the placement of the placenta should be known to you while suggesting any asana to any women. So taking their medical history and understanding their prenatal journey is a very important part of recommending any asanas. Now the second condition here is cervical stitch. If the woman has gone through a medical procedure where a slight cervical stitch has been given to her because her cervical muscles were weak not to hold the baby, so in that case, this should be avoided. Or any other pelvic opening asanas should be avoided in the cervical stitch condition as well. The third condition here is breech baby. Now, the positioning of the baby begins to establish itself from 35th week onwards. If the doctor has told the woman that after the test or ultrasound in the 35th week, the placement of the babies is the head is not down but upwards and the rest of the body is downwards, this is the situation where the baby has reversed. Ideally, the head should be down and the rest of the body should be up for a healthy, normal delivery. Now, in the breech baby condition also, this asana should be avoided. The fourth condition is hemorrhoids. Hemorrhoids is a commonly known condition in the pregnancy. It is also a condition for other people also, but in pregnancy it's common. Hemorrhoids is where there is slight bleeding from the anus because of acute constipation. So in that case also, doing pelvic opening asanas can increase the bleeding. So we should avoid this. Otherwise, there are many benefits of this asana, specifically practicing it in the second and the third trimester. The benefit includes that it helps with constipation, it helps prepare the body for the upcoming birth as we do squatting here. It helps stretches our thigh muscles, our calf muscles, our hip muscles. It also stretches and strengthens our knee and our ankles. So it's actually preparing our body to get into the delivery postures, specifically during the time of the labor. So this is also one of the labor pose that can be used at the time of delivery. Also, if it is practiced during the 9th month, what it does, it helps placing the baby in the right position and preparing the baby for the delivery. So this asana has many benefits, but a lot of conditions, there are a lot of precautions should be taken care. So while suggesting this asana, just keep that in mind. So we'll come to the practice now. The way we practice this is from the seated position, we will come into squat. Now while squatting, some women can go out of balance and specifically women who have never practiced squatting or are not in regular practice of squatting can feel absolutely uncomfortable in this. So in that case also, you can either avoid, or if you're trying to prepare their body for the labor, for the birthing process, and they have learned to do certain squatting, you can always suggest to take some support, either from the wall or a chair or someone helping them while practicing this. Other conditions that should be taken in mind is if the woman has asked you to suggest certain asana during the labor time, this asana can be suggested. But if the labor has started prior to 38th week, that is what we call preterm labor, which was before time labor, you can say, in that case, this asana should not be suggested, because that is a medical condition, and here a regular delivery norms or rules does not apply. In preterm cervix dilation also, preterm cervix dilation is where the cervix muscle are no longer able to hold the baby and they dilate prior to the time of delivery. That is 38 to 42nd week is the ideal delivery time. But if the cervix has dilated prior to that 38th week, in that case also, this is not a good labor pose. You should not be suggesting this asana. Otherwise, in all normal conditions, in normal pregnancy, this is a good posture to practice. Coming on from our seated position to the squat, some women can have heels lifted. In that case, if they want some comfort underneath their heels, you can place a slight cushion or roll the mat. Otherwise, we just come into squatting. Try to stabilize here and come into Namaste. And long and deep breathing in this. Try to remind them not to hold the breath, and if it's uncomfortable, they can come out of the asana whenever is required for them. If they can stay for a bit longer, that's also good. And releasing. Coming out of the asana, back into seated. Knowing the pros and cons of each asana in the prenatal phase is very important. And also, any student coming to you in the class, knowing her medical history, knowing her present condition during the pregnancy is a very important thing. So have your information intact such that you can always suggest that which is most suited for a particular woman during her prenatal phase. Always know that you have multiple asanas starting from the women who are at the bed rest to the perfectly healthy women. So you have bouquet of asanas to suggest to different types of cases in the prenatal case. So you can always feel confident there is something for someone, but suggesting any asana which is not suited for the condition of a pregnant woman is what we have to avoid here. So taking care of all these things is important. Thank you.